Rekha is a volleyball player. She has injured her elbow and has been undergoing rehabilitation on and off. She has had this issue over a year now and still feels stiffness around the forearm. As a coach, trainer, and therapist, you advised her to consult a therapist for a comprehensive treatment. So, what is your understanding of using acupuncture or dry needling for a problem and helping her recover faster? If you're looking for answer to these questions, you are at the right place. Welcome to this NPTEL offered course on physical medicine and rehabilitation in sports. We are in week 7 discussing various physical therapeutic modalities and alternative therapies in sports rehab. Today's lecture is on acupuncture and dry needling in sports rehabilitation. You are with me, Wing Commander Chandrasekhar Guru. I'm a sports medicine specialist with Armed Forces Medical College. The learning objectives for today's lecture is we will try to learn about the basic principles, differences, benefits and mechanism of action of both these modalities, acupuncture and dry needling. What is the rationale of using these techniques in sports rehabilitation and aligning them with the sports rehab phase? We'll also discuss a case scenario uh, in how you utilize this practically on a day-to-day basis. Acupuncture and dry needling is modern integration of ancient needling and the Western needling, wherein there is an increase in the preponderance of use of both of these techniques in sports rehabilitation. They are complementary to the traditional rehab program, and they help in kind of improving the effect of therapeutic exercise and manual therapy. This also of late has been backed by good amount of evidence, especially in case of acupuncture. Let's understand what acupuncture is. It's an ancient Chinese medicine modality. It is followed by insertion of thin monofilament solid needles into meridians to restore balance. What are these meridians? Meridians are considered to be energy lines along the body called as the qi, and kind of inserting needles along this energy meridians help in resetting the energy. It's used for pain management, inflammation reduction and muscle tension relief in sports. Research has shown that it is fairly effective in terms of treating musculoskeletal conditions, and the evidence is really good. What about dry needling? Dry needling is a Western medical approach wherein it focuses on myofascial trigger points. Basically, insertion of solid needles into these trigger points or taut bands stimulates muscle twitches and it resets the local muscle tone. It is developed from acupuncture tool, but then it has a clear, distinct, usage. So dry needling is more anatomical. It is not energy related, meridian based, and it is local. So the key differences between acupuncture and dry needling are based on the philosophy. Acupuncture is of energy related mechanism or a technique, whereas dry needling is more of neuromuscular. The technique itself is more of meridian based in acupuncture and it is trigger point or taut band based in dry needling, and the regulation and scope vary depending on the region where it is being used. What is the mechanism of action? Basically, insertion of the needle stimulates the afferent nerves, increases the local blood flow, releases chemical substances locally in the form of opioids and neurotransmitters. It also is seen to kind of cause pain reduction by the pain gate theory. Myofascial changes and the muscle tone also is affected, and the indication of these action is that in sports specifically it's used in muscle tightness and spasms. You can use it in chronic tendinopathies like patella tendinopathy or an Achilles tendinopathy. It's also used post surgically for faster recovery, especially acupuncture has a wide range of evidence in kind of used as a modality for pain reduction and increasing the healing in terms of post-operative knee arthroplasty or total knee surgeries. So it is also used in myofascial pain syndromes in sports scenario. Now the contraindications for needling mainly are bleeding disorders, it stands to logic. Any open or wounds which are infective wounds are contraindicated. If the patient has fear of needle or needle phobia, then obviously you cannot use it. Pregnancy is a relative contraindication. Various techniques that is associated with acupuncture are, depending on the region, can be body acupuncture, auricular therapy or ear therapy, which is again very popular. Nowadays, of late, acupuncture is also kind of combined with electrotherapy modality, wherein you use electroacupuncture, and scalp acupuncture is also another technique which is used. How about dry needling? Dry needling, again, it uses a piston technique wherein it can be either superficial or deep depending on the length of the needle, and you try to cause a fanning or a twirling to create that local twitch response. That is considered a desired outcome, and that is found to yield better result. Generally, the dry needling technique is subsequently followed by a stretching or a rehab therapeutic rehab protocol. So let's see a case scenario. Rekha is a volleyball player. As we discussed before the start of this lecture, she has injured her elbow and has been undergoing rehabilitation on and off. She has had this issue over a year and still feels stiffness around the forearm. As a coach or a therapist or a trainer, you are advised her to consult for further treatment, so that the treatment can be comprehensive because of the recurrence or persistence of the pain. So we checked what is your understanding about acupuncture or dry needling, and for her problem which would be a suitable option so that she can recover faster. So let's analyze this particular case. She is a volleyball player, 1-year-old injury, so it's relatively persistent, so chronic myofascial problem. It is located to the elbow, and there is soreness around the elbow. So the volleyball player gives a cue that sports demand of the sports is unique. Definitely, depending on the position of the player, the stress on the elbow is going to be high. It is a overhead athlete, so obviously the kind of generation of force is going to be there on the elbow. Subsequently, before going on to the recommendation, it is important to know what is the problem. To understand or identify the problem and to quantify the magnitude of the problem, it is important to assess the individual. So assessment will be in terms of assessing the mobility and flexibility, in terms of assessing the range of motion at the level of shoulder, at the level of elbow, and kind of also checking the scapular movement, since the individual is a overhead athlete. So scapular movement again plays an important role, so that needs to be checked and compared with the opposite side for symmetry. Thereafter, joint structure, again we have been discussing about joint structure, the surrounding tissues that can contribute to the mobility and the movement pattern. So joint structure and accessory motion can be checked by, say, joint play test or laxity test. That gives a fair amount of idea about the additional biomechanical motion that is available at the particular joint. So whether is there a problem with the joint structure per se, or the ligament or the stabilizing structure around the joint is at fault. So that gives an idea. It's also important, since it's a chronic problem, it's important to look around, palpate the other soft tissue structures around the knee, around the elbow, sorry. So that gives a kind of an idea about the soft tissue involvement, including the myofascial tightness or taut bands. So the assessment also must include the muscle also. So that gives an idea about whether the problem is mainly related to the flexibility aspect or it is related to the mobility aspect. So muscle length need to be checked. Strength testing is again an important aspect. So over a period of 1 year, so you might have weakness of the a persistent problem, so that there may be weakness of the muscles around the joint. So let's assume that the soft tissue is a problem here. So soft tissue myofascial thickening can be addressed, or trigger point can be addressed using dry needling. So that would be more of an anatomical approach where you could find and palpate a particular cause that would be a reason for this problem. So it is important to identify the cause. So since we could identify and locate the cause, it is better that we go in for a dry needling technique, wherein you can use dry needles to dry needling 1 or 2 sessions, and then try to see how much is the improvement in terms of the pain and the reduction in the pain, as well as in the individual's ability to continue the activity or therapeutic exercise. Well, the dry needling sessions are always subsequently, complemented with a proper therapeutic program. So it also enables the individual to be adherent to the program because of reduction in the pain and the spasm. So include stretching, static goals, especially to improve the tightness that is present in the soft tissues around the joint, and improve the range of motion and the strength. One more important aspect in all this chronic pain problem is that the biomechanical compensation which may have occurred over a period of time has to be addressed. And secondly, technique is an important aspect, because considering an athlete with specific sport demand, technique has to be assessed biomechanically using motion capture technique, and then accordingly corrective exercises have to be instituted. So, having known how we can kind of practically use the modalities, let's see what's the scientific evidence available. There's so many level 1 evidence available with respect to acupuncture, since it's a very old traditional medicine. It's been researched a lot across the globe. So it shows very good level of evidence in terms of low back pain and knee osteoarthritis. Cochrane reviews are there. They show modest level of evidence. They used commonly in sports scenario as well, and aid in better kind of complementing the therapeutic exercise and sports rehabilitation program. However, in sports scenario specifically, there is a requirement or need for high quality randomized control trials. How about dry needling? Dry needling, it reduces pain and improves the range of motion in myofascial pain. The EMG studies have also been conducted, which shows that there is definite change in the muscle tone as such after the dry needling. Generally, in most of the studies, they are combined with other therapies, either manual therapy in terms of releasing the soft tissue adhesions or soft tissue tightness, or it is generally clubbed with a stretching exercise or a therapeutic exercise. There is a growing level of studies are being conducted, randomized control trials, especially in physical therapy settings. Knowing about these two distinct techniques and what is their effect on sports rehabilitation, it is important to integrate them in your rehab program as well. So it helps to kind of give a comprehensive holistic approach to the program, and it can be combined with manual therapy or exercise therapy. Generally, it is found to enhance the neuromuscular control, thereby it helps in movement re-education and better movement patterning. Each and every individual is different, and it depends on the sport demand and the phase of sports rehab. So the utilization or integration of these modalities has to be tailor-made, and it's important to use or continue the traditional physiotherapy or physical therapy modalities subsequently after using a dry needling, because dry needling alone is not going to cure the problem. So it is important to communicate properly to the patient. So patient communication involves explaining each and every aspect of the procedure, about the kind of rationale of using or choosing a particular technique. What is the procedure that is involved? What kind of needle will be used? What is the difference in terms of the needling techniques and why it is being used, and gives the option to the athlete to make an informed decision. And generally post needling, there's a phase of soreness because it's an invasive procedure, so it will cause some amount of local inflammation and some amount of erythema and edema. So soreness will be there at least for to 24 to 48 hours. So that's important to be informed to the patient. It's also important to share any kind of success stories that you have and the available research evidence to a particular technique that is there. So that kind of gives also an important boost to the patient. And try to use simple athlete friendly jargons rather than using very technical jargons. Definitely, dry needling or acupuncture both have a psychological impact on the individual. It is a more of a mind-body connection and helps in recovery. It also reduces the anxiety and stress, and it improves the body awareness. They may be placebo as well as expectancy result playing a major role in the outcome of both the type of needling, but then nevertheless it is going to benefit the patient, so it is important to kind of consider that as well. Emotional benefits, especially in high stress athletes, because not playing and not being part of the team because of an injury itself is a major kind of stress. So it helps in kind of allaying that anxiety and then try to boost the confidence as such in the sports rehab program. It's important that we have been advocating that the modalities available are so much, so it needs to be combined, and the combination has to be in the better or the best interest of the patient, with the center of the treatment being the patient. So it should be obviously the needling program has to be backed up with mobility drills and stretching exercises. It can also be paired with other manual therapy and alternative therapies which are available. Generally, it's a good opportunity since the pain and the spasm also reduce. It is a good opportunity to enhance the neuromuscular re-education as such in these individuals, and kind of using other modalities kinds of as a synergistic outcome effect. It is also important to monitor the progress, because it may be alternative therapy, but then it is often important to record whatever the therapy that has been instituted and monitor the progress. We can use various measures like you can use a subjective or an objective improvement measures in a visual analog scale. You can use pain scores as the visual analog scales readings. Use a functional range of motion testing, which again shows if there is any improvement in the range of motion, or certain validated patient reported outcome measures also can be used to monitor the progress. Both the techniques have certain limitations. Balance the enthusiasm with clinical judgment and clear communication. Not suitable for all the athletes, and the risk of bruising and soreness is obviously there, and there is limited evidence in certain elite population. So it needs to be used with the kind of information that is available for the athlete to take the decision, so that the athlete is well informed about the existing evidence that is there for certain groups. So to summarize, both acupuncture and dry needling often are used as a complementary therapy, and they are very valuable tools as well, and they should be part of a multimodal plan, and providing a safe and evidence informed use of these particular techniques is very critical for improving the confidence and the kind of uh, reaching at the desired goal or outcome. Integration is not isolation, but then it should be kind of with the other combination therapies, and it's of a practical use in clinics as well. So growing evidence is there in terms of usage of acupuncture needling as well as dry needling in chronic myofascial pains and post-surgical quality of life indices. So it is important to incorporate these things in your routine clinical practice. So those of you who are interested in further kind of dwelling in depth in these particular topics, these are the references that you can kind of go through. Thank you for listening to the lecture. Jai Hind.